Welcome to American Black Journal. I'm Stephen Henderson. The Ebola outbreak in West Africa is the largest in history. More than 10,000 people have been infected in several African countries. And now that a few Ebola cases have been identified here in the United States, it's important to know the facts about the disease. Ebola is a virus that generally lives in animals found in Africa. Humans can become infected after contact with these animals. The diagnosis is made through a blood test. Ebola is spread through direct contact with bodily fluids from an infected person who is experiencing symptoms. And there is no medicine or vaccine for Ebola. Prevention is key. Joining me now is a member of Detroit's Liberian community, Reverend Charles Boayu of Second Grace United Methodist Church, along with the state's chief medical executive, Dr. Matthew Davis. Welcome to American Black Journal. So obviously this is something that's been in the headlines quite a bit. There's an argument about is this overreaction? Are people panicking? Or is this something that people should be really worried about? For you, Doctor, this is a very personal story. You're sitting here watching this sort of unfold in your home country and with your family.
Yes, indeed. Thanks for having me on the journal today. It is a personal story for me and many thousands of Liberians, including those in the Detroit metropolitan community. The reaction to Ebola, as deadly as it is, can be justified in many ways. You know, we just hope that people will moderate their reaction, learn the facts, so that our common humanity is not violated while people suffer.
Right, right. And what is it that you're hearing from your family in Liberia right now?
Well, about 7 weeks ago, my uncle, his son, and his son's wife died of Ebola in Liberia's second largest city, Ganta. Many who I know have died. People in my congregation have lost loved ones. And 2 days ago, I got encouraging news that it seems to be slowing down the number of cases showing up. I hope it would turn out to be the truth.
Right, right. Dr. Davis, so we've got, I guess, 10 people now in Michigan on a watch list for potential infection. Is that all we need to be doing? And how worried should people be here about the spread of the disease?
Well, Stephen, as we just heard from the Reverend, the real focal point for Ebola disease in terms of the outbreak is West Africa, particularly Liberia. And we have many community members here in Michigan who are directly affected.
Right.
In terms of Liberians coming here as family members or healthcare workers from Michigan going to work there and be part of the American effort to help and then returning, what we need to do is apply fundamental public health principles that we've been using for decades, even more than 100 years. That means if people have been at risk, in other words, have possibly been exposed to Ebola, we need to understand their level of risk and then act accordingly using the teams of people in local public health and state public health to make sure they have the support and the information they need to monitor themselves and get in touch with public health if they're concerned.
Yeah, yeah. Have you considered going back home to try to be part of the effort to stop that? I mean, is that something that you feel a pull to do?
Yes, I feel a desire to help. Although I'm not a healthcare professional, I go home every year for about a month, and I've been helping with other things. Recently, an organization I'm a part of partnered with the Detroit-based World Medical Relief to send to one of the hospitals in Liberia almost $600,000 worth of Ebola fighting medical supplies. And right now, underway, the Liberian Association of Michigan is working with World Medical Relief for a second similar container to go to Liberia.
And is that sort of the approach that look, let's figure out what we can do from here to sort of help with treatment?
Right, because even in Liberia, like Michigan is doing, and I applaud the efforts in Michigan, in Liberia, the government is not encouraging a lot of people to come in who will not be prepared to deal with Ebola effectively.
Right.
and movement within the country is restricted to try and contain the disease. So Liberians here, for the most part, who are not first responders, are trying to supply what is needed to those who are there to help.
Right. Doctor, I mean, I think a lot of people look at this, the situation in Africa and think, well, that could very easily happen here. Why is that not a valid concern?
We're not likely to see the same level of outbreak of Ebola here in the United States for a couple of reasons. First of all, the extent of the public health system and even the healthcare system in the U.S. is different than it is in Liberia.
Right.
There are some more resources and more personnel that can be used to immediately understand if a person has Ebola, who they would have come in contact with, and then take the immediate steps to try to control any further spread of that Ebola illness. As we've seen here in the United States, actually, even the healthcare workers who did contract Ebola as part of treating Mr. Duncan in Texas have now been appropriately treated and have both left the hospital.
Right.
There have been no other cases from that initial exposure.
Right.
So we're not likely to see a widespread outbreak. I do understand the level of public concern because Ebola is a major threat to human health, certainly in West Africa. And what we're doing here in Michigan is to try to respond with a clear plan and calm, while acknowledging that for many individuals and families, this is naturally on their mind every day.
Yeah, yeah. Do you feel as though, and this has got to enter your mind, I mean, just that imbalance, right? This is the wealthiest nation on the planet. Liberia is one of the poorest, and you see this outbreak there, and you see the lack of resources. It's got to be frustrating to sort of be here and feel that your home is such a different place and has such limited ability to deal with this.
Yes. Liberia recently came out of a 15-year civil war, a small country fighting for 15 years against each other. Left the country, its infrastructure, its ability to respond to any emergency seriously compromised. And so as the nation is seeking to rebuild, not only infrastructure like bridges and roads and schools and hospitals and transportation means, but also to build relationships among the people.
Repair that social and cultural fabric.
To come up with, for Ebola to strike so deadly and so quickly is very frustrating.
Yeah.
And those who help Liberia and Sierra Leone and Guinea are among the finest people on earth. Because when it comes to epidemics and things that threaten human life, as Ebola, we are all one.
Yes, right. There's no difference, right? Yeah.
And we look forward to any kind of help that can come. A statement has been made, and I don't know the source of it originally, that you know your best friends when you are in your worst compromised situation.
Right.
Those who truly come, who do not have to come, but come to your rescue, are the people who you will remember when you wake up and when you get up. So Liberia, America's longtime friend. America has had a relationship with Liberia longer than any other country in Africa.
People forget that this was, you know, dating back to President Monroe, this idea that a place that African slaves could go and sort of repatriate to the African continent. I mean, it's that old of a relationship.
Yes. In fact, sometimes I look at, America is facing its challenges too. Every country has those to do. But if you consider this Ebola epidemic and the opportunity it provides for American foreign policy in Africa. West Africa is the population center of Africa, from Nigeria to Senegal along the Atlantic Belt. It is the oldest economic and political part of Africa, maybe in part because of its exposure geographically to the Western Hemisphere. You know, most of the commerce and industry in Africa is along the Atlantic side.
Area.
This is an opportunity for the United States and any nation that loves democracy, since Liberia has elected Africa's first woman president, to build the kind of trust that we need as a model for the new Africa.
Right, right.
You know, it is an opportunity to build health infrastructures beyond a response to Ebola.
Right, and that could help with general health and,
Yes.
and maintenance, health maintenance, as opposed to responding to contagion or crisis.
And the resources needed to do that will be just fractions of the resources spent by the U.S. on many other efforts in the world that end up being wasted.
Right, right, that's right. Why is it that, Doctor, why is it that we're seeing this outbreak now in West Africa? I mean, I think everyone remembers that there was a pretty big outbreak before, and I don't remember what year that was, but what sort of allows the disease to sort of resurface in this way?
Sure, Stephen. What's thought about this outbreak is that it's the first one that has really affected urban centers in quite this way. The previous outbreaks over the past couple of decades in other parts of Africa have all been in much more rural areas, where even though there has been a rapid spread of Ebola, including in some limited circumstances to healthcare workers, essentially the spread could not be very much because the population affected was so small.
Right.
What has changed this time around is that major population centers in all three countries, Guinea, Sierra Leone, and Liberia, have been affected in major ways. And because of the limited infrastructure that we mentioned a few days ago, and the fact that healthcare workers themselves have been so dearly affected by the illness itself, the health systems in those countries have really struggled to address
They're
such a
overwhelmed.
fast-moving epidemic.
Sure. Yeah.
That's why the help of the United States and other countries, hopefully, that we'll see jumping in to help out will be so critical to helping bring this under control.
Right.
If we're not able to bring it under control, we will likely have this challenge of Ebola in many other countries around the world for many, not just months, but years to come.
Right, right. And so the state's preparation for this would include what you're doing plus some other things, correct?
Well, there are a couple of main things that the state of Michigan is working on with its local public health partners. One is the active monitoring program like we've talked about for any travelers coming from West Africa or in limited circumstances, healthcare workers here in the United States who may have come into contact with people with Ebola. The risk of each traveler is assessed, and the strategy for monitoring is put into play based on that level of risk.
Right.
Those individuals under monitoring who do not have symptoms are not a risk to the health of the public.
Right.
The other thing that we can do here in Michigan is team up together with other states that have said we want to encourage healthcare workers to do this humanitarian work.
Right.
We do not want to penalize them when they return. We certainly want to support them, and if they do have health risks, act accordingly. But we need to encourage the humanitarian impulse that people in healthcare have and want to express in their work in West Africa.
Right, right. And we are not discouraging, that's a good point. We are not going to discourage people from going to help. That's not good policy.
Correct. We must help control the outbreak in West Africa for our brothers and sisters there.
Right.
For their reasons, for their communities, and also for the world community that really wants to be free of this challenge of Ebola and wants to be able to respond in a coordinated way.
Yeah. Well, thank you both for being here. This is a crisis that hopefully will get past, and obviously prayers to your family in Liberia.
Thank you very much.